Well, the minimum unit pricing legislation came with a sunset clause, meaning its operation will be reviewed by MSPs in the coming months. To debate the policy's effectiveness, we have in the studio the Scottish Conservatives health spokesperson, Dr Sandesh Gulhane. And joining us from Aberdeen is the former SNP MSP Christian Allard, now co-leader of the City Council. Thank you so much for joining us, both of you. Christian, in 2021, we had the biggest number of alcohol deaths since 2008. But do you still think minimum pricing has been a success?
Well, I think the report is very clear that is saving more than 150 lives every year, and plus is reducing hospital admission, and more importantly of all, it's got a positive impact on our health, on everybody's health. We know how much Scotland has got a problem with alcohol, and we all have that problem as a society, and it's important that we reflect on the fact that all of us are not addicted, most of us are not addicted to alcohol, but we have to understand that as a society we need to care better for the people who have this kind of addiction, and we've got to make sure that we improve our health.
Okay.
And the point is very, very clear on that. It won't save people who are already deeply in addiction, but will stop more people becoming addict.
Sandesh, we've heard what Christian said, that it's saved over 150 lives, it's improved the health of the nation. This policy is a success, no?
I mean, you just heard from Christian just there how confused he seems to be with what he's saying. It does not help the people who are heavily addicted to alcohol. It makes it worse. In fact, the studies are showing that some people are switching from weaker alcohol to spirits, which means they get more heavily addicted, they're more heavily intoxicated, and they do that quicker. We're seeing no change in people who are addicted. We also have the highest level of deaths. We have a much higher level of death than in England. The data you're seeing is actually statistical extrapolation from what is essentially a small data set. So it doesn't tell us a true picture of what's going on.
OK, Christian, I'll let you respond to that. But also, was the policy not aimed at helping these people who were the most addicted to alcohol? And is that, in that sense, has the policy not failed?
It's aimed to save lives, and it's exactly what it's doing. It's saving more than 150 lives a year. Now, these lives is our lives. Saving life is very, very important. And the cost to families who have lost a loved one, like my family have. I've lost my wife 20 years ago to alcohol addiction. And I can tell you that the minimum unit pricing would have maybe not saved her life, but it would is saving just now 150 lives a year. This is a very small price to pay. 50 pence or even 65 pence a unit, a very small price to pay. We need to think about all the families who have lost loved ones.
Yeah.
That's a very heavy price to pay. So, of course, people who are too far gone in addiction, it might not help them. But that's a tool in a toolbox to try to improve the health of the nation, our health of everyone.
You've described it as a blunt instrument, but surely every little bit of help that people can get, it's worth doing.
Well, as a GP, I see people with addictions a lot. And the thing that we need to be clear on is when people ask for help, they have a window. Normally a crisis has occurred, and that window is finite for them to get the help. But currently, there is not the help available. The Scottish Conservatives have a right to recovery bill, which would guarantee and enshrine into law that the people who ask for help will get it. So what we need to do, if MUP was being put in today, I would want to see that the £120 million that has been generated somewhere be put into helping people with, and by doing that in addiction services. That's where we need to get help. We also need to look at availability, and we also need to look at the way that alcohol is sold. And those are the ways we need to go together.
Christian, could the money that has been made from this not be funnelled into these extra resources that Sandesh is suggesting here?
Regarding the money, last year more than £100 million was made available to Alcohol and Drugs Partnership to support local and national initiatives. We had the minister, Anna Whiteman, coming up in Aberdeen a couple of weeks ago, and she saw all the good things that is done to help people in addiction. As I said, minimum unit prices is not automatically something who's going to save everyone, who's going to be the solution for everything, but it definitely has very good result, is what this report is saying.
But
having
Christian,
a conservative MSP today...
Okay,
yeah.
but Christian, are there enough policies in place as over and above the minimum unit pricing to help people who are desperately needing it?
Oh yes, we are using all the tools that we can, and as I said, more than 100 million were spent last year just to do that. One thing important about minimum unit pricing is I remember the Conservative voting for it at the time. Yeah. I don't know why they changed their mind. Dr. Sandesh Gulhane is thinking about changing his mind.
Have you changed your mind?
The policy. That policy was accepted by the Conservatives at the time. It's a policy that saves 150 lives a year. Let's put that
to Sandesh. Do the Conservatives still believe in this policy in principle? You did all vote for it the first time round.
The first thing to say...
You weren't there, admittedly, but your colleagues voted.
So the first thing to say is Christian thinks it saves 150 lives, but that is a statistical... extrapolation from data.
Do you still support the policy in principle, Sandesh?
As far
Tell
as
me
the
that.
MUP is concerned, I have grave concerns about the fact it is not helping those who need it the most. So I would not want to see an increase to 65p.
You wouldn't want to see an increase to 65p, but do you still support the policy continuing in its present form?
I think we need to look further into it, and I think we need some more data, because we have a very small data set.
Well, you've just had all the data you could possibly wish for today. You know how you can see how it's panning out. Would you still support it?
We don't have a big enough data set, quite frankly. What I'd like to see is further data. I'd like to see more information. If you look at the studies that have been performed, 40 studies, only one of them is being positive about MUP. 7 are showing that there is very little statistical data, and 32 don't even talk about it. So there really isn't very much data here.
Christian, would you support the 65 pence?
Oh, I've heard what Alcohol Focus Scotland are saying, and when you look at inflation, I will understand why 65 pence would make sense. But I know that the Scottish Government is going to look at it. What I want to hear from the Scottish Conservative today, how are they going to help us saving 150 lives
Christian,
they need to.
We'll have to leave it there, but Christian and Sandesh, thank you both very much indeed for joining us.